Hi, I'm Ruth, and this video is about PGP, pelvic girdle pain, SPD, symphysis, pubis dysfunction, and general joint hypermobility. There is some evidence that autistic people are more prone to all of those conditions in pregnancy because we are generally more prone to joint hypermobility and co-occurring conditions such as Ehlers-Danlos syndrome. So there are two considerations when thinking about those areas. The first one is pregnancy and maintaining your comfort as much as possible throughout pregnancy. So some people do find it beneficial to have a conversation with a physiotherapist, and they might have something like a support belt or use tight restrictive clothing that can help with the tactile sensation of looseness that goes along with any of those conditions. Some people are able to access hydrotherapy or other water-based gentle exercise that helps to ease the signs and symptoms of any of those conditions in pregnancy. It can also be worth looking from 37 weeks onwards at using a TENS machine as a gentle low-lying level of pain relief that you can use safely day and night. And incorporating as much rest as you can. So if you are working, sitting where you would usually stand, and during your day-to-day routines at home, sitting as much as possible, and sitting on something like an exercise ball where you can frequently adjust your position and allow movement through the pelvic region, which can really ease up the symptoms of PGP, SPD, and joint hypermobility. And then the other consideration is actually during birth. One of the really important things is that if you accept or you are request an anesthetic pain relief that is actually going to numb the signals that you're receiving from your lower limbs, then have a note made of how wide you can open your legs before you experience discomfort, and make sure that your legs aren't opened any wider than that at any point during birth, or you can potentially exacerbate those symptoms and go on to have continued pain postnatally as well. And then being aware of the positions that you can birth in, because you may find the typical position of your legs being open quite wide really quite uncomfortable. So using positions like sideline release or any position where you have your knees in and your calves out can make a difference to the underlying level of discomfort that you feel both during birth and postnatally as well. I hope you found this helpful. Thank you very much.